Hi there everyone, Jeffrey again. This is part two of the vlog video for today. As I mentioned in the first video, I wanted to just split them up a little bit. So part two, I just wanted to share with you my thoughts and just some context on what's been happening on cruise ships specifically with the COVID-19 or coronavirus pandemic and the response that the cruise lines have been providing. One thing I like to do when I can is a little bit of myth busting. In an age of social media, it's just so easy to spread untrue information or half-truths or subjective opinions that are passed off as facts. And some of those can actually be damaging or cause massive misunderstandings. Now, those of you that follow the cruise line industry, some of this you might be aware of. Those of you that don't so much, some of this might be new information for you. Essentially what happens is we're within several weeks, depending on where you are in the world, of either recommendation to shelter in place, lockdown that's being referred to sometimes, or in some cases, in some counties, states, provinces, countries, that it is an absolute mandatory lockdown, again, depending on where you are geographically. The cruise lines globally started to suspend their services about 3 weeks ago, which ultimately resulted in, within several days of each other, a complete global shutdown of all cruises as far as guest itineraries are concerned. Ships either went to ports of call, docked, disembarked all the guests, kept crew on board. Some kept skeleton crew on board, some kept all the crew on board. Depending on what was happening on board, some were forced into quarantine, some guests and crew were repatriated. It was very much on a case-by-case basis. There is still one ship that's sailing currently, the Holland America Zaandam. The reason why it has guests on board is that ship departed on its itinerary before the major part of the pandemic hit globally. And so that's why they are still cruising. Why haven't they docked and disembarked the guests? Sadly and unfortunately, because every country they've tried to go to has refused them entry. They won't allow any guests or crew to come off, regardless of their current health status. I'm happy to report that Broward County, which is the county in which Fort Lauderdale lies, and that's where you would find Port Everglades, one of Florida's largest cruise ports, the county and town council have voted in support of allowing the ship to come in to disembark the guests into a quarantine situation and in a staged manner to disembark the crew that are not required to be on board for the operation of the vessel. So that's positive news. Now, on board vessels, I already talked about the sanitation procedures and the public health procedures that are followed on board. But a lot of what I've seen online as well lately has referred to the COVID-19 response and how that's affecting the crew. Because there are ships, again, that some are lucky enough to be alongside docked in port. The ports fill up, and along the coast of Florida and in other parts of the world, off the coast of Australia, specifically outside of Sydney, there are ships that have to anchor, and they're essentially stuck there. Some ships have taken to basically just going on cruises to nowhere and just having back-to-back sea days because they have nowhere to go. Now, for the crew on board, they didn't stop being paid when the guests left. Some cruise lines ended crew contracts while on board and gave the crew opportunities to stay in cruise as a guest. They would be fed, watered, have a place to sleep, stay, access to the medical facilities, the crew recreational facilities, and they were allowed to do that if they didn't want to go home or couldn't go home because of travel restrictions that were in place. Other cruise lines are, again, paying the crew. What concerns me sometimes is when I see extremely negative, very subjective opinions being spread online that the ships have been turned into prisons for the crew. That is absolutely not the case. A lot of cruise lines in the last couple days have instituted mandatory lockdown procedures where all crew members, regardless of health status, are quarantined in their cabins, basically to either prevent a spread or outbreak on board or to contain and quell an existing cluster of positive cases on board. It's a prudent decision to be made, and frankly, it makes sense. Now, a lot of crew members, the majority on board, are in roommate cabins, so assigned 2 people to a berth or a cabin. What the cruise lines have done, the majority of them, have taken the crew and separated them, so everyone has their own cabin. But what a lot of cruise lines have done, as a gesture of goodwill, have put all the crew members in guest cabins. So previously, when they're in a very small, it is a tight space, bunk bed style roommate cabin with no natural light window or porthole, they're now in guest cabins, many of them with balconies. They're by themselves. A lot of the cruise lines, specifically Royal Caribbean Cruises Limited, which covers Royal Caribbean International, Celebrity Cruises, Azamara, Silversea, and several other smaller brands, have provided free Wi-Fi to the crew, where previously they had to pay. The guest TVs, all the movies have been opened up to be free. They're getting room service, food delivery, water delivery to their cabins. So the cruise lines are truly doing everything they possibly can to keep the crew, number one, safe and healthy, and as comfortable as they can possibly be. We have to recognize that this is a unique situation. We're dealing with a global pandemic. Cruise lines are very safe, while at the same time, it's a very contained environment. There's hundreds and hundreds of crew on board, and we have to take serious measures and steps to ensure the public health and crew health on board. So to vilify cruise lines for the steps they've taken, I think is unfortunate and unjust. And again, cruise lines are doing everything they possibly can. One thing that I'm happy to report as well, Royal Caribbean made the decision because Australia has closed all of their ports to all cruise lines, namely after the, I believe it was the Regal Princess situation took place there a couple of weeks ago with a lot of positive COVID-19 cases on board. Again, Australia closed all their ports. So what Royal Caribbean Cruise Lines has done is they have taken crew members off the Radiance of the Seas, transferred them to the Spectrum of the Seas, and the Spectrum of the Seas is now doing a milk run to the Philippines, Indonesia, Singapore, I believe Japan, and also through another country to repatriate Indian crew members back to India. They are going to stop in all of these strategic ports of calls that are in Asia to offload the Asian crew members and get them home. Because they can't get flights or they can't be offloaded in Australia or New Zealand, to get on flights to go home, Royal Caribbean on their own accord has made these arrangements to drop the crew members off and get them home as soon as possible. I think that's an incredible decision and very smart on behalf of Royal. I don't work for Royal Caribbean, so I by no means am biased towards them in any way, but I think it's the right thing to do. Meanwhile, cruise lines like Carnival have offered themselves up as floating hospitals to the United States government. And I see the people posting that, that's a cash grab and Donald Trump and Mickey Arison are good buddies. This transcends that. A cruise ship is a fantastic place to put non-critical yet hospitalized patients on board so that there is space in hospitals, on land, in ICUs for those serious COVID cases. The other option is pop-up hospitals in convention centers and subway stations. When a cruise ship has an onboard medical facility with an emergency room, with ICU capabilities, with ventilators, with emergency physicians and emergency nurses that are ER, OR, or ICU trained, or all of the above, I think it's a fantastic thing to do and prudent during this time. When cruising starts up again, and those of you that return to being guests on cruise ships, this is why crew harp you so much on washing your hands, and washing your hands. Wash your hands constantly, before you eat, after you use any restroom facility on board, whether it's in your own cabin or it's a public washroom. I can't stress that enough. Wash your hands. Ships are similar to hospitals in that you'll find hand sanitizer throughout. Use it. It's not just for your safety, it's for everyone's health and safety on board. You might think it's silly, but it's truly not. You'll see the crew doing it. In fact, the cruise lines that I've worked for, crew members are not allowed to enter the crew mess facility until they, not using hand sanitizer, actually used hot soap and water to wash their hands before they step foot in the crew, staff, or officers' messes. And it's policed. There are employees that literally will stand there, and if a crew member tries to walk through, they're stopped, sent to the sink, and they have to wash their hands. So if the crew can do it, you can do it too. Nobody wants to get sick at home, let alone on a vacation or for crew members when they're at work. So that's it. That's my take and some background on what's happening on cruise ships with COVID-19. As new updates or information come available, I'll ensure that I add those in upcoming videos. If you have any questions that I haven't covered in part 1 or part 2 of the videos that I'm posting today, feel free to send me a direct message or post a comment to these videos, and I'll answer anything and everything that I possibly can. So once again, stay safe, stay healthy, wash your hands, and wash your hands.